Good evening, friends. Another anecdote which we came across in our professional practice. A 40-year-old male was brought to us with history of decline in memory, not able to recognize anybody. He could not recognize his own wife also. He could not identify which place he was staying in, where he used to move about. Nothing he used to remember that. As if this is not enough, as if from jumping from frying pan to fire, he had double incontinence. What do you mean by double incontinence? Not able to understand where he used to pass urine, not able to comprehend where he used to pass stool salts, urinary incontinence and fecal incontinence. This we call it as double incontinence. My videos, my topics are not only to address the medical population, but more often than not, perhaps it is so to address a non-medical population also, the lay community at large also. Hence I am using not only some technical jargon, coupled with that I am trying to simplify it into routine colloquial useful words. This person had no history of diabetes, no hypertension, nothing else, but on dwelling into detailed history, we came to know one striking thing. He was an alcoholic. He was dependent on alcohol for the last nearly 10 years. I asked him, did you have any fall any time? Did you have any convulsions any time? I don't remember. History of incontinence, history of cognitive impairment, memory decline, disorientation, not able to recognize his own relatives. What do you suspect in an alcoholic? You must rule out, my friends, what's called as a subdural hematoma. I immediately summoned him for an MRI brain scan, and lo, my thinking was not wrong. The MRI brain scan revealed that he had indeed a subdural hematoma. We sent him to a neurosurgeon who diligently operated on him, and subsequently he is now back to normalcy. So my friends, alcohol can produce all such problems. Is it a really enjoyable drink? No. Previously people used to say that alcohol is protective to the heart also. No more so. The detrimental, the dangerous to your heart, your brain, your muscles, your all organs in the entire body also. Alcohol, the neurological symptoms can be, the side effects, the adverse effects can be, as I told you, a cognitive decline, a memory loss, a dementia process, ongoing dementia process, acute delirium, fits, seizures. Sometimes they throw what is called as rum fits. What do you mean by that? Fits which occur as a consequence to withdrawal of alcohol. He used to drink rum or alcohol, now he stops, he throws what is called as alcohol withdrawal fits. It is colloquially called as rum fits also. This can be produced by chronic alcohol consumption. Ischemic stroke, hemorrhagic stroke can occur as a consequence of chronic alcohol ingestion. Myopathy, alcoholic myopathy, alcoholic cardiomyopathy, detriment to your heart also, toxic amblyopia. People have lost their eyesight because of chronic ingestion of alcohol also, my friends. These are the adverse effects of alcohol consumption. Of course, Marcia Fabignan disease, movement disorders, ataxia, tremulousness, all these are again adverse effects of alcohol consumption. And caffeine consumption, that also can produce headache, that also can produce withdrawal seizures. These are all some of the substances. So also there are some people who keep on consuming alprazolam, barbiturates, that also can produce memory decline, that also can produce dementia, that also can produce seizures, convulsions also. So these are some of the things about which one has to be careful. Cannabis, ganja, charas, bhang, hashish, they are all substances which can produce dependence. We have seen quite a good number of people who used to smoke ganja, and what did they develop ultimately? Ganja-induced psychos. Very common, especially around Hubli and all that, many people used to, even now also, consume ganja, and we have seen a good number of, a higher incidence of ganja-induced psychosis. My friends, these substances, be it ganja, be it nicotine, be it tobacco, be it chewing gutka or ganja, they are all detrimental to your physical health, to your mental health, to your social health, to your occupational health, to your financial health. Please advise your patients to refrain from all this. Thanks a lot for watching the video. God bless you.